Hello everyone. Let's begin with the continuation of the topic hypolipidemic drugs. That is drugs used in hypercholesterolemia. Okay. So the question is which of the following drug is PCSK9 inhibitor used for familial hypercholesterolemia? Option number 1 rosuvastatin, 2 fenofibrate and 3 niacin. Fourth one is alirocumab. Okay, these are the four options. So we have to identify the PCSK9 inhibitor which is used for the treatment of familial hypercholesterolemia. Okay, the option number 1 called rosuvastatin. So it is a HMG CoA reductase inhibitor. It comes under statin group. Okay. So in this rosuvastatin, it acts by inhibiting HMG CoA reductase. So all the statins should given at bedtime because the activity of this enzyme HMG CoA reductase is maximum in the midnight. So all statins should give at bedtime. Okay, and it reduces the cholesterol synthesis. Okay, but except two statins which can given at any time, one is atorvastatin and another one is called rosuvastatin because of their longer half life. So atorvastatin ranges from 14 to 18 hours and rosuvastatin is the longest acting statin. Of life it is about 18 to 24 hours. Okay, and these statins are important hypolipidemic drugs in reducing LDL cholesterol. So maximum lowering LDL cholesterol by these statin groups. Okay, second one fenofibrate. It is a fibrate or fibric acid derivatives, acts by activating the enzyme called lipoprotein lipase. Okay, by nuclear PPAR alpha receptor, that is peroxisome proliferator activated receptor alpha. It is a gene regulating transcription receptor. Okay, this is expressed in liver, fat and muscle. So helpful in the degradation of VLDL. Okay, so these fibrates, they are mainly used to reduce triglyceride levels. Okay, so combination of these rosuvastatin with fenofibrate, they are used in the treatment of diabetic dyslipidemia, where there is a diabetes associated with elevated triglyceride levels. We can give these fenofibrate, that is fibric acid derivatives. These are the important hypolipidemic drug. They maximum lowering the triglyceride levels. Okay, and niacin, option number 3, it is vitamin B3, and this niacin is act by inhibiting lipolysis in adipose tissue, and it has maximum increasing HDL cholesterol property, good cholesterol, that is HDL, which is increased by this niacin. The limiting feature of this drug niacin is it produces flushing and pruritus because of its vasodilatory action. Okay, because of its cutaneous vasodilatory action, there is a release of prostaglandins and produces this pruritus and flushing. So it can be prevented by giving pre-treatment with aspirin. Okay, that is a limiting feature of this niacin. Coming to the option number 4, that is called alirocumab. It is the drug comes under PCSK9, that is proprotein convertase subtilisin kexin type 9. Okay, it is a protein that binds LDL receptors. okay, and transport these LDL receptor to the lysosome where there is a degradation takes place. Okay, instead of recycling of these LDL receptor on hepatocytes, okay, they get destroyed. So these PCSK9 inhibitor, okay, they act by, okay, inhibiting the degradation of LDL receptors and reducing the, okay, LDL cholesterol. So this drug called alirocumab, it is a monoclonal antibody against PCSK9 type, okay, inhibitor, and it is approved for familial hypercholesterolemia, okay, as an adjunct to diet. So among the four options, the drug called alirocumab, it is comes under PCSK9. Okay, it is a PCSK9 inhibitor. Okay, so answer is option number 4. Thank you all.